Can the words used on your MRI report dictate your clinical outcomes in lower back pain? Let's talk about this super interesting study because it not only studied patient effects, but it also looked at its impact on the behavior of healthcare practitioners when it comes to managing patients with lower back pain who are getting MRIs. MRIs are often used in patients with chronic lower back pain because after a certain point when the patient gets frustrated enough, they want to really know what's going on inside of their back. So this is a classic example of a lumbar MRI, and what you see over here is something that we call a disc herniation, which is something that is seen in many patients with lower back pain, but herniations can also be seen in many patients that have no back pain at all, or people that have recovered from back pain and are currently asymptomatic. They are a valuable tool without a doubt, and they help us make important decisions about whether a patient may need higher levels of intervention like surgery or injections, or they could help us reassure a patient to let them know that something isn't necessarily wrong there and this may be a byproduct of normal aging. However, just like any tool, MRIs can be used inappropriately, and if you order an MRI too much, you're often going to get patients who see abnormalities on their imaging when that abnormality may have nothing to do with their pain or presentation. This study sought to look at patient and provider behavior based on the types of words that are used inside someone's MRI report. One group of patients got classical terminology for an MRI, meaning they saw things like herniated discs, spinal canal stenosis, disc degeneration, degenerative disc disease, things of that nature, which are commonly seen in a really negative light, even though those findings might actually be fairly benign. And another group got terminology that was used that reassured the patient that even though there were spinal changes that happened in their spine, that those changes were age-related and were fairly normal and not anything to be worried about. So here are the results of what happened to the patients. So on the top left-hand corner are the pain scores for patients at different time periods. When the patients were given reassuring terminology, their pain scores are outlined in orange. Over a period of time, their pain actually declined when they were given reassuring terminology, and they also were less likely to need higher levels of intervention. When patients were given the more negative terminology, their pain scores actually increased over time. You could actually see their quality of life scores actually change quite a bit. Where the patients were given the reassuring terminology, their quality of life scores actually improved over time, or you could see the patients with the negative terminology saw their quality of life start to decrease over time. Remember, for this study, we are only changing the words used by the doctors when interpreting the reports. Everything about the patient's initial stage and condition was the same, and their treatment along the course of care was the same as well. The most interesting part of this study was actually what happened to doctors' behavior. So they gave doctors two different types of MRI reports. They gave one group the routine classical terminology that was often seen in most MRI reports, and then they gave a different clinical type of MRI report which de-emphasized the severity of some of the findings seen on the MRI report. And then three types of doctors, specifically the orthopedic surgeons, the orthopedic residents, and the physical therapists, the level of severity interpreted by the reports dropped off pretty significantly, but most importantly, the level of invasiveness about those findings dropped off a cliff for those types of providers, whereas the spine surgeons tended to have a similar view regardless of the type of reporting, because those physicians often actually look at the images, where the other types of providers actually only looked at the reporting itself. This is still really important though, because an orthopedic surgeon, an orthopedic resident, or a physical therapist are oftentimes the first types of practitioners that are going to engage with a patient with chronic lower back pain, and those are oftentimes the decision makers. And for those decision makers, there was a statistically significant reduction in their chance for recommending surgery when they were given the clinical MRI report as opposed to the routine type of MRI report. So we could see that terminology really matters, especially for the patient, but also the doctor as well, because we live in an era where patients can get their MRI report results, they'll Google it, and then that Googling can turn into something that the authors called cyberchondria, where they're actually looking at the definitions for some of these terminologies, and it starts to freak people out because they don't have the context behind some of these findings, and it's up to us as healthcare providers to be able to provide that context and to reassure a patient when we know that those findings aren't necessarily going to give bad healthcare outcomes. Suffering with chronic pain is really difficult, and taking care of some of these patients with chronic pain has a lot of challenges. And I say this as someone who has probably screwed up many times on patients by overemphasizing some of their imaging findings when I could have taken that time to reassure them. In a time when patients can Google all the terminology that we use, it's more important than ever that we really explain the context of what someone's findings can mean on an x-ray or an MRI. And especially we take that time to reassure patients that even though they might have changes on an x-ray and MRI, that those changes aren't necessarily destiny, that they can still have full function, be able to live their life, to walk, to travel, to get up, to move, even when they have a herniated disc in their back or a degenerated disc in their back, as long as we do things to help improve the capacity for our patients to move and live a healthy life.